So, Chuck, can you tell me why you decided to incorporate the OsteoGen bone grafting products into your practice and how long you've been using them?
That's a great question. So I've been using it now within my practice for almost 13 years. Um, what drove me to it was issues that I was having with traditional grafting materials,
Mm-hmm.
mainly bovine bone, some allograft material, particulates in general.
Mm-hmm.
This was really a leap to have a tradition, the advantages of traditional grafting materials, but with better outcomes. And we brought it in because of really ease of use initially. That's what drew me there first to the product. As a general practitioner, we're jumping from room to room. We're having to be every specialist all day long. And for my patients, I wanted something that was going to be very straightforward to use, predictable, and allow me to move to the second stage of treatment, which would be either implant placement or traditional prosthetics. And this really fit the bill as being able to do everything for me at once. And one of the other reasons that I really was intrigued by it was the ability to grow bone that was in some ways much better than what I was getting in the past. And I think that's due to just the change in the type of formulation. With its bioactive crystal technology, it is something that is very different from the majority of other grafting materials that are out there, especially materials that are treated in their production with high heat, being sintered, and the issues that can occur with that by them not breaking down. With this product, with the bioactive crystal technology, what it allows me to do is to predictably graft, know that I'm going to change the localized environment to be conducive to regeneration of bone, and therefore not have the additional problems that I've seen with other materials.
So, you've been using OsteoGen for many years,
Hmm.
and obviously during that time, new products have continued to come out.
Yes.
So, if you had to summarize, what would be your top three reasons for why you've chosen to stick with OsteoGen and not make a leap to one of the newer products that have come out?
That's it. Over the years, I've been able to utilize this material for most of my grafting needs. It's extremely versatile. Initially, it was in a plug form, and those plug forms were great for socket preservations. We used it initially for grafting around implants also, and then as new products developed and came on the market, namely the strips and the blocks, then that kind of changed the way that I started to think about it. And this material works so well to grow bone that I started to think about in my own practice, why am I limiting it to just socket preservation situations? Started using it for immediate implant placement, started using it for vertical sinus lifts. And then other products came out, which I've tried. And I think, as a practitioner, you have your go-to product, but then you try to see if maybe something that's new on the market is going to be a little bit better. And what I found out is that it wasn't. Either it was a situation where it took too long to turn over, or maybe it was a situation where the handling properties were not as, I wasn't as comfortable with it. It posed problems with me. One of the issues that I don't necessarily like about particulates or any product that ends up being a particulate, and there are a lot of composite type products that are sold as either a plug form or a block form that once handled really just become a particulate. And for me, that's not what I want. That poses bigger problems. I like to be able to place something in that is going to perform the way that I want it to perform. And this product and this class of products really has, not only the bioactivity of the localized environment to influence bone growth, but also the combination of the OsteoGen crystals and the bovine collagen, that the complex that it makes creates a situation where we don't have soft tissue downgrowth. And that to me is very important, because as a general practitioner and trying to make things affordable for my patients, this has really been a great product, because I don't have to use an additional membrane in most situations. It's essentially place the plug, suture it in place, usual post-op instructions. And I know predictably in 2 to 2.5 weeks when I come back that everything is going to look good. We're going to start to see soft tissue closure over the top rather than diving down. And predictably within 3 to 5 months, I'm going to have good bone. And it's very easy to determine that because I can look at a radiograph and the product goes from radiolucent to radioopaque during that time. So it's an easy way to check. We'll bring a patient in, we'll graft them, we'll do the usual post-op, and then at about 3 months, we'll bring them back, take a PA. If it looks like the density has changed or the radiopacity has changed, then we know that we have bone there, and then we can move forward with whatever treatment we want to do. If we don't, because sometimes it takes a little bit longer in some patients, then we just bring them back a month later or 2 months later and reevaluate.
Gotcha. So a word that has been thrown around a lot has been the word bioactive. When you think of OsteoGen and bioactive, how would you describe that?
That's a great question. It's bioactive. I look at it bioactive on 2 levels. I look at it on an ion exchange level, and then I look at it as a physical level also. So on the ion exchange level, what it does is it changes that environment, and as the crystals are broken down, and these are crystals that are not heat treated, so they haven't been sintered, and therefore they're highly porous, they're intertwined, they break down in the fluids of the socket, and what they do is they provide calcium, phosphate, and hydroxyl groups. And those three ions are extremely important for new bone growth, right? We have calcium, which is going to help convert osteoblasts into osteocytes, also providing a mineralized portion for that changeover. We've got phosphate, which is going to encourage osteoblasts to come into the site in the first place. And then we have the hydroxyl groups, which are changing that localized environment to be a more alkaline environment, which is highly conducive for mineralization and counters any of the issues that we see in acidic environments, which usually slow down bone. So that's how it's going to change things chemically in there and make the area conducive for regeneration. And then on top of it, like I mentioned before, we've got the crystals intermixed with the bovine collagen, which then is creating a physical barrier for soft tissue downgrowth. So therefore, we're going to see fibroblastic proliferation. It's going to come across the top of the socket, and routinely within 2.5 weeks, that socket is epithelialized, and then the graft is really protected underneath it. So again, predictability for me, not having to worry about a membrane either coming out unwanted, and or in a situation where a technique where you're using a membrane that is non-resorbable, like a PTFE membrane, where you're going to have to come back at 4 weeks and pull that membrane. Most of the time, in my experience, what ends up happening is patient comes back at 2.5 weeks and half that membrane is flopped out, and then you're dealing with potential complication at that point. And as a general practitioner, the least amount of issues that I can create for myself, the better. I want to be able to move forward with treatment that's going to make a happier patient. It's going to make for a happier doctor and less issues to worry about.
Can you describe the difference between sintered and non-sintered regenerative materials?
Sure. So sintered materials are materials that during manufacturing are subjected to high heat. And these high heat is used in these other materials as a necessary part of manufacturing. So it's either to make crystals or the right size in order to be able to be used as grafting materials. But the problem is that when you sinter a product, you change the physical property of it. And what ends up happening is you lock in all of the potential good things that we see, like the phosphate groups and hydroxyl groups get locked in place. They don't want to really share ions very well. And the bigger problem that occurs is that once these things are sintered, they become ceramics. And these ceramics are very difficult for the body to break down. And instead of being able to go through a regular regenerative process, it tries to take an extreme measure and ultimately results in encapsulation in many situations. And some of these dense materials are never able to be broken down. And so that's a problem. And so on a radiograph, it's very difficult to tell because these materials are also very radio opaque. and this radiopacity never really goes away. And so you look on the x-ray 2 months, 3 months, 4 months down the line, and you say, oh, it looks like I have a lot of bone. And then you get in there to place an implant, for example, and you realize that there's still unincorporated portions of graft material that are just encapsulated with connective tissue. And where that becomes a problem is you can achieve primary stability at that point, but now long-term, that's going to be a problem. Once you've restored that implant down the line, you do not have true bone-to-implant contact at that point, and therefore all the mechanical stresses that are going to occur during normal mastication are going to stress that bone. It's not going to react very well, and then that's where we may be seeing these either moderate or medium to long-term failures. So it is a big problem. It has been identified on the medical side in orthopedics because of the vast quantities of graft materials that they use. There is documented literature of immunologic responses that are kicked off by the fact that you cannot break down these materials, and the body tries to break them down through other means and ultimately recruits what are called giant cells. And these giant cells, then when they encapsulate these products, the only place that they can take them away is through the large filters of the body, which is going to be the liver, spleen, and lymphatic system. And if you have a large enough quantity of material that has to take that route, it has been shown to cause problems potentially. So in my own practice, I don't want to make more trouble for a patient. I don't want to be the one responsible for potentially having some sort of issue happen. So I'd like to have a material that I know is, by the time that it's breaking down at 3 to 5 months, that there is very little to no crystal that's still available.
So how would you describe a non-sintered material?
So non-sintered material obviously is not subjected to high heat. The OsteoGen crystals are non-sintered, so therefore they are a lower density, but they're highly porous. And this high porosity allows for better ion exchange. And also the fact that they're not sintered, like I said, they're able to exchange ions very freely with the surrounding cells. And that is going to make regeneration much, much easier for the patient and obviously the body. So we're getting complete turnover, and the quality of bone that has been seen on histology is excellent compared to some other products that are out there.
So you would make the recommendation to other clinicians that having a non-sintered regenerative material is really important.
Absolutely, absolutely. And I think that a lot of practitioners may not understand the situation, or at least understand what sintering is, or that their product that they're currently using is sintered. They just know from the physical properties that they see. Going back in at 5 or 6 months and still finding material that looks untouched, high radio opacity, things like that. And they don't really understand the mechanism behind it and why it is. And I truly do believe it's very important. And as we move in dentistry, just like we've moved in medicine, where we're looking more for biologic healing, and we're looking to have materials that are bioactive, that are allowing the body to heal itself. This is the perfect material to do that, where it's not throwing up any barriers, it's not throwing up any problems for the body to turn it over. And our ultimate goal when we are especially in alveolar ridge preservation, is we want to be able to regenerate bone in that site that basically histologically is no different than the surrounding bone. And that's the key. And if we can do that, then the options are open for either implant treatment or other traditional prosthetics.
So OsteoGen uses bioactive crystal technology. How would you describe that?
It uses bioactive crystal technology in the fact that what it's doing, you've got a biomimetic crystal, meaning that microscopically it looks just like laminar bone. It also has a makeup that is very similar to laminar bone, with the amount of phosphate that's in it and calcium that's in it. And therefore, you're starting off with a product that is very biofriendly. And then because of the way that it's manufactured and the way that it will contribute to ion exchange, that it's a product that's very conducive to the body being able to work with it. And I know that's kind of simplification of it, but really that's what it is. We're having a product that the body is going to not see as foreign and is going to break it down readily. It's going to provide our ions in the proper ratios that need to be done. For example, with calcium, one of the problems with some products is if the calcium levels are too high or too low, then that's going to affect what happens with the osteoblasts, for example. So if you have a calcium level that is too high in the area, what it's going to end up doing is it's going to end up killing off osteoblasts rather than letting them proliferate and eventually change to an osteocyte. If the level is too low, then what you end up in that situation is you have a lot of osteoblasts that come into the site, but they never get signaled to change into an adult bone cell or an osteocyte. And so you end up with essentially woven bone or an unorganized bone within that site, which again is not what we need. So the optimum is about 8 millimolar of concentration of calcium, and that has been shown to be the optimum ratio or the optimum concentration in order to encourage an osteoblast to turn into the osteocyte, which is what we need, because as soon as it becomes an osteocyte, it's now going to create a haversion system, and it's going to create a bone that is going to be a great recipient for a dental implant down the line, because the ultimate goal is that implant needs to be placed and you need to have bone grow into the surface in order to make it successful.
When you think about the competitive landscape, are there any other products that come to your mind that have something similar to bioactive crystal technology that is unique to the OsteoGen product line?
That's a great question. There is not another product that is the same. There are a lot of products that have come out in recent years that physically look the same, meaning they're grafting options that are in plug form. Okay. And these plugs that are out there are either, the mineralized portion is either a carbonated apatite, or in some cases it might be bovine bone that's mixed in there, but they're created in a plug form, and they're not like for like, because now either in a carbonated apatite situation or in a bovine bone situation, you now have a centered product that's mixed with collagen. And even though it looks the same, it doesn't behave the same. And many of these products, if you look at their instructions for use, we're looking 9 to 12 months for breakdown or what they're suggesting before you come back to do additional treatment. And in my eyes, that's too long. It's too long. And if it is taking that long, then there's also, in my thinking, that much of that product is not going to get turned over completely. It's going to end up being encapsulated. It's going to end up creating some bone, but it's not going to be the same quality. So I don't think it's like for like, and I think it's very important that clinicians can differentiate between that when looking at everything that's on the market today, and to get beyond just the sales pitch of the particular product, right? And really know, well, what is the difference on a molecular basis? What is the difference on the actual product that's in there that is supposed to be the grafting portion? And so it's important, and it muddies the waters a little bit, but there is not another product out there that has the same formulation that OsteoGen crystals have.
So you would say that OsteoGen is really unique and in a category of its own in terms of bone grafting materials.
Absolutely. Which, and it's amazing because it has a long track record. This is a product where the crystals have been around for almost 40 years, used in various ways, and now they're combined with collagen in a multitude of shapes. So as was stated earlier, not just plugs, but strips and blocks. And what it really gives you is a number of different grafting options that are specific for clinical situations. And you can decide what works best in that situation, whether it be an immediate placement, whether it be a socket preservation, whether it be an onlay graft. And this technology is proven. The plugs and in the form of the composite grafting plug, for example, has been used. Millions of them have been placed in the last 13 years, and are well proven that it does exactly what it's supposed to do.
You know, you talked about that there's a lot of competitive products on the market. I mean, it can be confusing, right? There's a lot of choices, a lot of the language, the way the products are described are very similar. What are some maybe 2 or 3 questions that a clinician could ask that would help maybe simplify as they're looking or considering different regenerative materials to add to their practice?
I think, you know, a few things that are important to ask is one, what is the bioavailability of the product? Is it just acting as an osteoconductive framework, or whether it's actually contributing to the regeneration of bone? I think that's number one. Number two, what is the timeline that is expected for turnover? And does that turnover happen 100%, or is there a high percentage of graft material that's going to be left at the end of the day? And then I think finally, the handling characteristics, I think, are very important. I know in dentistry, there's so many products across so many different categories that it all comes down to handling. You ask 10 doctors about composites, and they'll give you 10 different composites that they use, and the only real difference between them all is how they handle. And when I've taught courses and we talk about grafting, I always encourage doctors to try products and see in their hands what makes sense to them and what handles the way that they would like it to handle. And I truly feel that these products handle so easily, so predictably, with minimal complication, that there really is not another product to look at. I'll stake my reputation on that.
Yeah. And plus, it has the bioactive crystal technology,
Yes.
which is creating a very robust and favorable environment for regeneration.
Absolutely, and that's something that nobody else has at this point. And it's like the greatest hidden secret in dentistry. Those doctors that I know that have been using these products for years swear by them, and new doctors who get exposed to them say, why do I not know about this? Because they use it and their results are great, and they just wonder, well, it seems so easy, it seems so straightforward, but it is, and it comes down to the bioactive crystal technology that is really the heart of all this.